Services and Public Health. I hope everybody is doing well. I think we do these block grants every year, and that's why I want everybody to know that Appropriations and Human Services and Public Health are the hardest working committees in the General Assembly, because we meet all year round for everything. So I want to thank everybody, and I'm not going to bother asking, does anybody want to say anything, because we've got a lot of people and a lot of things to go forward. So I'm sure my fellow co-chairs for Human Services and Public Health either are on or getting on, and I know my co-chair for Appropriations is on. And before I get started, I just want to wish my co-chair happy birthday, because it's her birthday today. And for her birthday excitement, she's joining us for this block hearing with all of her closest friends in Appropriations, Human Services, and Public Health. So happy birthday, Senator Austin. And I hope you don't have a lot of meetings. I hope you're going to go and sit outside and watch the mosquitoes and your dogs and okay? Promise me, this is the last of your meetings and you're going to chill out for the day. Okay, well, we'll move on to next. All right, Madam Administrator, may I start with the first speaker today?
We're all set, Madam Chair.
Okay, good morning, Commissioner Jutani. I want to welcome you. This is probably going to be your first appropriations hearing that I know of with us. I don't see you though.
My video is on. Can anybody else see me?
Yep, now we can see you. Now we can see you. Thank you, thank you. Well, welcome, and it's a pleasure meeting with you on this time, and I hope to see you, much more of you, as we go forward. And thank you very much for joining us. So I want to let everybody know that we have just a few commissioners that are going to present, but their support staff are here to answer any question. So what we'll do is we'll let each one present their portion of the block grant. And if anybody has any questions, we'll answer them and we move on to the next one. So Commissioner Jutani, welcome. Go right ahead.
Thank you very much. It's wonderful to meet with all of you today on my second day in the job.
Oh, wow.
So good morning, Senators Austin, happy birthday. Formica, Abrams, Somers, and Huang, and Representatives Walker, France, Steinberg, and Pettit, and distinguished members of the Appropriations and Public Health Committees. My name is Dr. Manisha Jutani, and I am Commissioner of the Department of Public Health. I'm here to present the department's proposed federal fiscal year 2022 allocation plans for the Preventative Health and Health Services Block Grant and the Maternal and Child Health Services Block Grant. You have my testimony in front of you, so in the interest of time, I will be brief and provide you with highlights of the two grants. The proposed Preventative Health and Health Services Block Grant Federal Fiscal Year 2022 funding estimate for Connecticut is based on the federal fiscal year 2021 funding level of $2,230,840. The estimated FFY 2022 allocation will include a basic award of $2,150,926, in addition to a mandated sex offense set aside of $79,914, intended to provide rape crisis services to rape victims. Preventative Health and Health Services Block Grant funds support work in asthma, cancer, cardiovascular disease, childhood lead poisoning, diabetes, smoking cessation, injury prevention, suicide prevention, rape crisis programs, and support for the state's emergency medical services, Connecticut's public health surveillance and evaluation efforts, and national and local public health accreditation initiatives. Health priorities and program categories for FFY 2022 remain the same as those approved in FFY 2021. The Maternal and Child Health Services Block Grant Plan is based upon a proposed FFY 2022 budget of $4,663,927 and was put in place to promote the development of service systems in states to meet critical challenges in reducing infant mortality, providing and ensuring access to comprehensive care for women, promoting the health of children by providing preventative and primary care services, increasing the number of children who receive health assessments and treatment services, and providing family-centered, community-based, and coordinated services for children and youth with special health needs. Additionally, this grant provides case management services for pregnant women, maternal and child health information and referral services or through the 211 hotline, reproductive health services, oral health, school-based primary and behavioral health, infant health and well-being, newborn screening, and medical homes for children and youth with special health needs. Through this work, Department of Public Health staff have identified an alarming trend in data on perinatal indications and indicators. Infant mortality rate, teen birth rate, low birth weight, and lack of perinatal care was disproportionately higher for non-Hispanic Black and Hispanic women than for non-Hispanic white women. This trend has persisted for many years. Several Department of Public Health programs, including the Maternal Mortality Review Board, are working to address this trend by supporting the Alliance for Innovation on Maternal Health Patient Safety Bundles. Thank you for the opportunity to testify. I appreciate your consideration of these block grant allocation plans. If you have any questions, agency staff and I will be happy to answer them.
Thank you, Commissioner, and again, welcome. I ask any members if they have any questions, since there are so many people on here. If you please could raise your hand and I will then recognize you. So if you have any questions, please raise your hand by going to the raise your hand button on your screen. And Senator Austin, go right ahead, ma'am.
Thank you very much, Commissioner, and it's a pleasure having you here today. I've noticed in a lot of the block grants that some of the expenses have been moved from the block grant expenditures to the general fund expenditures of the budget. In these two block grants, were there dollars that used to be spent in the block grants or expenses that used to have happen in the block grants moved over to the general fund?
So I'm going to ask, I'm not sure if Chuma is on the line or if there's somebody else from our department who might be able to answer that more specifically.
Maybe Deputy Commissioner Aaron, or let's see who else. I'm trying to look on.
What is it? Maybe your CFO? Is your CFO on?
Good morning. This is Deputy Commissioner Heather Aaron. I think Chuma should be on.
Deputy Commissioner, if I may interrupt for just a moment. Chuma is one of those folks that we're having difficulty letting in.
Okay.
But I can allow him. He has permission to speak. So Chuma, can you, for some reason your mic is muted, but I've given you permission to speak. Chuma?
Yes, can you hear me now?
Yes.
Yes.
Wonderful.
Okay. So good morning, and my name is Chuumang Amichi. And to answer your question, Senator, the answer is no, we do not have any identified line items within the block grants that we've made provisions to be picked up on the general fund.
Thank you very much for that. I just want to pay attention to any expenditures that we're moving from the block grants over to the general fund budget. Thank you. Thank you, Commissioner.
Thank you.
Thank you. Representative Dillon.
Thank you very much, and welcome, Commissioner. And thank you for highlighting the birth outcomes, which have persisted in Connecticut, I don't know, since I've been here. and much more by race than by teen pregnancy, for example. What I'd like to know is, given the horrifying reports we've seen around the country about the birth outcomes,
Pat, I believe did your microphone, did you? mute?
the host muted me, ma'am. I'm trying to, given the horrifying tales that we're hearing of birth outcomes of unvaccinated young pregnant women around the country, is the department working? I know you just landed, so I don't want to be unfair to you, but is there a particular initiative or outreach to that population of young women concerning the risks to themselves?
So the very end of your question got cut off for me, but I think I understand the gist, which is that is there specific outreach happening to women who are pregnant given the COVID outcomes? And I know that there have been efforts, through multiple different departments to target this community in general, and particularly pregnant women. But I will ask if there's anybody, I don't know if Rosa is on the line and might be able to take that question in more detail, or if there's somebody else that might be able to answer it more specifically.
I believe that Chuma has his hand up. I'm not sure if he's answering that question or if it was from the previous conversation.
It is from the previous conversation. I'll take it down.
Thank you. Is there anybody from public health that can assist the commissioner in answering that question?
Hi, this is
Go ahead, Donna.
Rosa. I'm sorry, I didn't mean to interrupt if Rosa was going to speak. I'm looking for my raise hand button.
Yes, good morning. This is Rosa Biaggi. Good morning, all. I'm the chief of the Community Family Health and Prevention section. And this is the section that manages both of these block grants. Regarding this question, Donna Maselli, you probably have some information, and also if there's anyone from the infectious diseases, particularly from the vaccines program, that individual may be able to provide additional information to what Donna can provide.
I wonder going forward, because it might not be available today, if we have any data on young women who are either pregnant or I guess pre-pregnant. I don't know. I suppose everybody is. Well, not everybody. Just because the stories are just so scary out of Florida and so forth, and it would be really helpful if we could get information about that, about what you're doing, what we can do to get the word out, and in a culturally competent way, and any data that you have.
So, Commissioner, if you could have some information put together and submitted to Madam Administrator so that she can get it out to all the people, all the legislators and that are on this call today from Appropriations, Human Services, and Public Health. Is that acceptable, Pat?
Oh, absolutely, Madam Chair. And I don't want to be unfair to a newbie here. We want to be welcoming, but it's kind of a different issue.
Okay, thank you. Thank you, Commissioner. So you got to buy today. For Pat to say that, trust me, take it.
I appreciate it.
Okay, thank you. Next, Representative Porter.
Thank you, Madam Chair, and welcome, Commissioner Jutani. Thank you for being with us. And listening to pretty much, I'm gonna piggyback off of some of the concerns that Rep. Dillon raised around the infant, teen, and low birth weight with women of color. And you mentioned a patient safety bundles. Could you just expound on that a little bit and tell us what that is, how it works? And I'm really curious to know, what is the plan, and not necessarily today have you outline it, but get back to us on, how are these funds going to help to address, And this isn't just a Connecticut issue. This is a national issue. This has always been the case. What are we going to be doing here in Connecticut that will be effective in addressing the maternal, infant, and teen mortality rates?
Yeah, I mean, this is a very, very important issue, and one that we know, is affecting, like you said, this population throughout the country. But we obviously have an obligation to take care of our citizens here in Connecticut, specifically on this issue. And so like you said, I am getting up to speed on a number of things in this area, but I do want to ask some of our content experts. I'm not sure if Mark, if you could address anything specifically in this area regarding how we might be addressing this.
I'm sorry, who are we trying to get in touch with?
Commissioner, if I may.
Yes, please go ahead.
Okay, so we have a couple of things to follow up on the question that came earlier about what we did through the pandemic. We have our WIC program, and all of those mothers we reached out to specifically and kept in touch with, and make sure we set up, vaccination and testing programs. So we've been through the pandemic working with our moms with their young children from 0 to 1 year old, as we normally do. There have been some additional programs, and we can send that data out to the committee. As far as our AIMS project, we have our expert Donna Maselli, and Donna can go through the 3 parts of the AIMS program. So Donna, could you kindly expound on the AIMS, please? Thank you.
Sure. So the AIM, or Alliance for Innovation on Maternal Health, is a national driven maternal safety and quality improvement initiative. And it's based on proven safety and quality implementation strategies. And through that, AIM works to reduce preventable maternal mortality and severe morbidity across the state. So DPH is funding, providing a contract, $60,000 a year for 3 years to the Connecticut Hospital Association to assist in rolling out 3 patient safety bundles, patient AIM safety bundles. The first is the severe hypertension bundle, and it looks at policies through the hospitals as far as the time to treat, early identification, the timely administration of antihypertensives and so forth, as well as follow-up and a warm handoff post-delivery to the primary care provider. The second one is the venous thromboembolism AIM patient safety bundle to help prevent clots in pregnancy, pulmonary emboli, which could be lethal, and so forth. And the third patient safety bundle is a maternal mental health bundle to identify and treat those women that have anxiety, depression, and so forth during pregnancy and postpartum.
Representative Porter?
Yes. Thank you, Madam Chair. Thank you for that, Donna. And I think all of that is great, but I think the thing that really sticks out to me is the issues. You're talking a lot about the mothers. What are we going to do to address the biases that exist in healthcare when it comes to treating women and people of color in general? I mean, like, we have moms that go in and complain, and they get sent home basically to take an aspirin. Not technically, but that's the sentiment. Is there anything being done to address, the care, the disparity in care that they're receiving? And I think that's a big underlying cause of why we see this maternal and infant mortality rate so high in communities of colors with women of color.
That's certainly implicit bias is a major problem, and we're very much aware of that. DPH has a CDC maternal mortality review grant to support the maternal mortality review committee and program. We're doing a lot of implicit bias training. We've done it for our committee, our 28 members of our committee that review these cases and make recommendations for preventing subsequent deaths. We're doing training, implicit bias training for hospitals. I know the Connecticut Hospital Association is doing implicit bias training. We've had several implicit bias trainings to increase awareness and we're also, DPH is doing a media campaign. We've been running it through July. The CDC has this Hear Her campaign, where it encourages women to speak up, especially women of color that sometimes aren't listened to simply based on the color of their skin. So it encourages, if you're on Facebook or a friend of DPH, you'll see those Hear Her campaigns. It's an amazing public service announcement or awareness campaign. It shows women, it puts faces to the women that have died. We've got stories of spouses of women who have experienced discrimination or bias during their delivery, and nobody listened to them and they died. So we're we're continuing that. We just got additional funding to continue that through our grant for a couple more months.
Thank you, Donna. And just my last question to you, Madam Chair, and then this is a conversation that I'll continue as a sidebar with the commissioner and her team. But is there any data being compiled? Are we keeping up with outcomes? And, we're talking about the training and all these things we're doing. How are we monitoring the progress or the success of them?
DPH is very data-driven. Everything we do is data-driven. We monitor our vital statistics office monitors they have Connecticut registration reports that are available online on the DPH website. Currently, for example, the teen birth rate in Connecticut is 8.9 per thousand. Nationally, it's 16.7. And although it's coming down nationally and in Connecticut, we are seeing disparities. We track teen births by race and ethnicity, race, age, and ethnicity. For example, white women, the teen births from 2015 to 19 was 2.8 per thousand. Black women was 14.5 per thousand. And Hispanic women were 25.3 per thousand, almost double. So we are seeing disparities as far as teen births. And the problem with teen births is they have a higher, if it's a teen mom, she has a higher risk of having a preterm baby with issues. So we're doing a lot of teen pregnancy prevention initiatives at DPH. We've had a grant since 2010 through the Family Youth Services Bureau, a teen pregnancy prevention program that has amazing outcomes and data. And I can share that with you if you'd like.
Yes, I would. You were reading my mind. You share it with all of us, I would ask, to have that data and those numbers reflective straight across the board, not just with the teen pregnancies, but also with the adult pregnancies. And just want to say thank you to the commissioner and team again, and thank you, Madam Chair.
Thank you, ma'am. Thank you for your questions. Next, we have Representative Foster. Good morning.
Hi, everybody. I'm really grateful to hear this report from DPH today, and welcome, Commissioner. It's a pleasure to hear you and have you here. And Deputy Commissioner Aaron, it's always a pleasure. I am interested in this. I personally had a very traumatic birth experience, but do health equity work and research myself. And so as I'm hearing this, there's this seed that I've had in the back of my head that I've been thinking long since my election, that we notice a lot of the data, like Representative Porter asked, is there to exist in a sort of output way that the Connecticut Department of Public Health routinely measures outputs, but we do not collect data in a way that we can attribute outcomes to the interventions that we do. So we can say it like multiple cross-section points, like here are a slew of things that we changed in the last 6 months. And then we see this difference in maternal birth outcomes, but we can't attribute those outcomes to a specific intervention to know that we should preferentially fund one thing or another. And I'm really excited and happy to hear about all the health, the implicit bias training that's happening. But I'd like to plant the seed that there are some trainings that are evidence-based and effective, and there are some that aren't. And it's like a burgeoning field. And I don't know that, I just want to, I sort of would like to know what trainings are happening and are they evidence-based is my first question. And my second follow-up question is there a way that we can have actual outcomes attributed to those trainings to make sure that they're working? I think that a lot of times we're like, we did 3 trainings and then we saw a difference in maternal mortality, but it could be that a neonatal ICU unit got new equipment that allowed them to better care for a child and actually have nothing to do with bias training, and it could have to do with improved birth outcomes because the hospital was better equipped. Or we could see corresponding declines in maternal outcomes because of, this is just like a hypothetical, but let's say like a decrease in acuity of staff at a community hospital and changes in outcomes in their NICUs, perhaps like a shift from RN to lower skilled support staff in a NICU. And so I am worried that the way that we have data aggregated, and now we're seeing this influx of money, that we're going to have a challenge attributing data to those specific changes. And I don't know, this is like a short timeline, I think, from the allocation of the funds and distribution to set up those data parameters. But I would just urge folks to consider like making sure that that data is collected in a way that's more outcome, less output related. And I think that's like in no way a criticism. I think that that's the way like the federal data is collected also. Everything's also output related. It's just like it's more expensive to assess outcomes. But I'd also like to say that I'm happy to volunteer to help support and screen tools using my expertise as a research scientist if that's helpful. But I do think that that's an opportunity, a missed opportunity if we're not judicious to assess that we have an influx of in these grants. We're going to be allocating money and resources. Did we allocate them in a way that the money resulted in this outcome that we think it is? Because that's not the way that the data that we collect that I've seen presented does. It's everything's cross-sectional. It doesn't allow causal implications. So that's my sentiment, and I'm hoping it looks like Ms. Maselli has an answer.
Well, can I, before we get into the answers, OFA gave everybody a printout on the dollars in this. So I just want to let you know that there's not an influx. It's pretty much across the board. The funding has basically stayed the same. And in the block grants, they sort of choose directions that they need to have focused on in what they're going forward with. So I think that it's important to realize that they're changing some paths and elevating others in this, which obviously you have a lot of expertise in and a lot of information. I just for a question, are you on public health, the public health committee?
Yes.
Awesome. Okay. So the reason why I asked that is because we want to sort of, and I've been a little okay, but I want to keep everybody sort of focused on the block grant per se. And we could be here for 3 hours doing this. So I just want to stay sort of centered in that. So I want to open up the channel of discussion for you, but I also, we have a lot more people in here. So I'm trying to keep the subject and the materials going in the direction to get to the end result, which is voting on the block grant. So I'd be glad to have Ms. Maselli respond, but I think a broader conversation
offline.
Yeah, and I mean, we'll be happy to help facilitate that. But I think your DPH committee will love to jump into that and get your expertise in that. So
I'll just say one comment on this, if I may, just that, I was going to also just reiterate that this is specifically for this block grant. So I'm glad, thank you for clarifying that. Secondly, just, I think in general, as a scientist, I'm sure you share my, concern about attributing specific interventions without doing, a large multivariable model and controlling for different things that would be contributing to specific outcomes that you're looking at. As a scientist, it's very difficult to attribute, specific thing to a specific thing without controlling for a lot of different things. So I share your concerns, and I think it is important to look at what has been done and what the outcomes are. But I do think that is a challenging question to tease out in some ways. So just wanted to point that out. And I think Donna, did you want to say something additional on that?
Yes, just with our implicit bias trainings, we evaluate the increased knowledge and increased awareness, the actual training itself. And I agree with our commissioner absolutely that it's hard to attribute a decrease in maternal deaths to implicit bias training. But for our teen pregnancy prevention, we do use evidence-based programs. For our case management, we do have pre and post data from the kids. So we've got actual outcome data on the benefit of the education that's being provided, the evidence-based programming. And our case management programs all use evidence-based screening tools for screening the women. So, but I'd be happy to share with you and talk offline. Thank you.
Thank you. Thank you very much. Are there any other questions about the block grant per se? And Representative Foster, I hope that everybody will participate in your conversation, and we all love data, just saying. Senator Austin for the second time.
Thank you very much. I have a question under the Preventative Health and Health Services Block Grant. Under the Rape Crisis Services, that's a fairly small dollar amount. It's a fairly small grant, relatively speaking. Is that for in-service rape crisis providers, or is this administrative only?
This is Donnette Wright. I'm the coordinator for the Preventive Health and Health Services Block Grant. The $79,000 is the minimum that is prescribed by CDC for us to fund the rape crisis services, and it supplements other dollars that they get from the DPH. But that is to provide, it's not only for in-service, it provides rape counseling, crisis counseling for the women, accompaniment to make the reports to the police officers. It also provides, what is it called? Testing, rape testing for the women. It basically provides the women with support in making the police reports.
Okay, so it's for in-state providers.
Yes.
That's
we
what
fund the alliance. Yes.
Okay, thank you. Thank you very much, Madam Chair.
Thank you. Are there any other questions? I do not see any. So if you would be so kind just to sort of remain to the rest of the questions, because sometimes questions lead right back to DPH or any of the other committees. So thank you, Commissioner, and good to see you. Next, we have Department of Mental Health and Addiction Services, Acting Commissioner Navareta.
Good morning, everyone. Good morning, Senators Austin, Abrams, Representatives Walker and Steinberg, and other distinguished members of the Appropriations and Public Health Committees. I am Nancynavareta, Acting Commissioner for the Department of Mental Health and Addiction Services, or DEMAS. I'm here to present the federal fiscal year 2022 allocation plan for the Substance Abuse Prevention and Treatment Block Grant. The SAPT Block Grant allocation for 2022 is based on the funding level enacted by United States Congress for 2021, which was $18.2 million. So I'd like you to note that under the President's proposed budget, we could next calendar year potentially get additional dollars, which would bring that number up to $37.3 million, but that has not been approved yet and won't be approved until next calendar year. So to plan effectively with minimal risk to DEMAS's system stability, our allocation plan is consistent with what we did in 21. So the actual allocation could differ up or down as this happens every year, and we would adjust accordingly. The block grant represents only a portion of DEMAS's spending for substance use prevention and treatment services. Most of the programs which are funded with federal block grant dollars also receive state funding. The state funding component is not reflected in the plan before you today. Block grant funded activities include substance use prevention, education, multiple treatment modalities, and recovery supports. As in every year, the block grant, SAPT block grant puts aside 20% directly for prevention activities as is required. The SAPT block grant allocation plan was crafted to align with federal funding requirements while maintaining a state-specific lens, allowing services to meet the continuum of substance use needs while functioning safely in a global pandemic. There are several proposed allocation changes from last year's plan due to the anticipated approval of the recently submitted SUD waiver or substance abuse demonstration project. This is in application. We are in the process of applying, so this has not happened. The timeline now looks like December 1st of 2021. If this is approved, it will shift substance use disorder residential treatment services currently funded from non-reimbursable state-only dollars and block grant dollars to Medicaid, where the services will receive a federal match. Since SAMHSA encourages block grant dollars to be spent on services that are not otherwise reimbursable by Medicaid, this allocation plan includes a number of changes to shift the now reimbursable services to the general fund. Specifically, these changes include 70% of the funding for the substance use residential treatment programs currently on the block grant will be eligible for Medicaid reimbursement or match, and will continue to fund the residential treatment service for the non-Medicaid eligible and unentitled individuals. The following levels of care and programs will now be funded by the block grant: methadone maintenance, prevention clearinghouse, hospital emergency department recovery coaching, transportation services, senior outreach and engagement, women's recovery support programs, and our access line. DMIS continues its close focus on efforts related to addressing the opioid crisis. Strategies to respond to the opioid crisis include opioid treatment program, provider hours, increased mobile MAP vans in underserved areas like Eastern Connecticut, supporting the access line to ensure 24/7 connection to services to those seeking help, placing recovery coaches in the ED, mobile employment services, justice-related services, and supports. DMIS is diligently moving forward to ensure that the resources available to address the service needs of our citizens are widely used. The FY 2022 block grant allocation plan is an important component of us reaching those goals. So that concludes my testimony, and certainly happy to take any questions. Thank you.
Thank you. Thank you very much for your testimony. I'm going to jump in really quickly and then go. You talked about the recovery coaches in the ED. How many recovery coaches will we be funding, and where are they going to be located?
So actually at this point, with the combination of our federal dollars through our SOAR grant and opioid specific dollars and the block grant, we are in 22, I believe, emergency departments. So we are statewide, and that is through CCAR. They're doing an excellent job.
Okay, and how much money is being shifted to the general fund?
So if you look on page 6 of your OFA analysis, it's a swap. So it is the amount of funding in the block grant is exactly the same. No provider contract has been decreased, and no services have been decreased. So in preparation for the waiver being approved, we have moved what will potentially be Medicaid reimbursed onto the general fund, so that we are then poised to be able to receive the federal match and not be supplanting any funds on the block grant. So the biggest is the 5.5 million under residential treatment. That is your 69.8%. That is directly related to the waiver.
And the residential detox and the residential long-term treatment?
You are correct.
So the total will be approximately $5, $8, $9, $10 million will be shifted over to the federal fund. I mean, to this general fund.
Under residential treatment, actually, the bolded line is 5.5 million.
Okay.
It actually rolls up instead of.
Oh, I see. Okay, my bad. I was adding that in. Okay, so it's 5.5. Okay. All right. Let me go to questions. Senator Austin.
Thank you very much, Madam Chair. And I want to go along that same line. if we move money over these over to the general fund, you're saying that there will be no decreases in any provider currently there. Is that true?
That is correct.
And secondly, leading on to that, if it is approved for the 1115 Medicaid waiver, would that 5 million that we move over be a match? Because there's always some sort of match. So are we actually going to see an increase in spending in residential treatment?
When this is implemented, you are absolutely correct. So the intention is to now capitalize on the state dollar. So what was previously paid for 100% on the state dollar will now get a match, and we will be able to reinvest those dollars in our substance use system of care.
And my last question is relative to the adult mental health. It looks like there's a 5% decrease in adult mental health. And I'm curious, is there, are you using other dollars to supplement that 5% loss or that loss in adult mental health?
So I can continue with the test. Are we switching to the mental health?
Oh, I'm sorry. Don't forget it. No.
Okay.
Oh, I'm sorry. We'll wait. Thank you. Thank you, Madam Chair.
Thank you. Representative Dillon.
Thank you, Madam Chair, and thank you, Commissioner. Welcome in your new hat.
Thank you.
Would it be accurate to say that the pending waiver would effectively transfer policymaking on substance abuse to the Department of Social Services?
We would continue to be the state substance use authority, and we would continue to be the content experts and policymakers in that area.
As this sort of thing was contemplated years ago when I was a new legislator, and it was very controversial, and it led to the behavioral health partnership oversight, which was actually authored by my co-chair at the time, Chris Murphy, because we were trying to resolve legitimate distrust on the part of some of the folks in the community about the. Is there an MOU in the works between DEMAS and DSS or any kind of an oversight council about shifting control of the dollars to this extent over to the Department of Social Services?
Thank you for the question, Rep. Dillon. We already have MOUs through the partnership, as you alluded to. So our meetings and our development of the application has been through the partnership with DCF involvement, OPM involvement, DSS involvement. So all of the state partners and our sister state agencies have been at the same table during this time. And the plan has been taken both to MAPOC and to the Oversight Council, the BHP Oversight Council.
The way that it's structured, though, DSS is going to control the money. Is that true?
I don't think all of the pathways for the finances have been determined yet, but paying a fee, it will be a fee for service model through DSS so that the match, we can bring the match into the state and then reinvest that in the substance use continuum of care. So it will be paid through Medicaid.
Well, I know people know this, so I don't want to fatigue anyone with the data, but that we had testimony this year from the medical examiner that we had a 30% pop in overdoses from fentanyl statewide. Data Haven recently released data that there was a 40% increase in fentanyl overdoses in a 5-town area, one of which includes the town I live in, and Woodbridge and Hamden. I don't remember who all else was involved. One of the things I learned in environment this year, which I never expected to learn, is our alcohol issues, because we were looking at the consumption of NIPS, and Connecticut and Massachusetts, apparently the two states with the highest NIP consumption. And it would be great if it was just a couple of guys watching a Huskies game, but it's not. It's a guy standing on the street corner who drops it in the gutter, who theoretically is in recovery. I was interested in the data on the consumption statewide. It did not go, the NIPS consumption did not go by population. There were some towns that had high consumption, and it wasn't a linear relationship at all. So I don't know how much alcohol plays a role in some of the violence we're seeing, but obviously there are social effects. So I certainly don't want to share things that other people know very well, but some of the things that are important may have kind of fallen to the wayside because we were consumed with the pandemic. And in the meantime, there's a lot of social issues out there. It's my fervent hope that there will be some accountability as this block grant process moves forward, because as Representative Porter was talking about the maternal outcomes, trust in the provider is a huge component of recovery, and just as it is, frankly, in getting somebody to prenatal care. So I hope, and I realize that this is a number of people are going to be making this decision, that whatever happens is going to be a collaborative effort, because getting it wrong would have devastating social consequences.
Thank
Thank
you.
you for that.
Thank you, Representative Dillon. Representative Foster.
Quick question. I didn't hear mention in use of this block grant, and perhaps it's because this isn't the right place, but Narcan, and similar to what Rep. Dillon was sharing, with increase in fentanyl overdoses, my local police force is reporting using significantly more doses of Narcan for overdose than ever before. And now they're having issues sourcing and they're having to reallocate their budgets to source Narcan. So I didn't hear that was part of the budget, or perhaps it wasn't in the overview, but perhaps that is something worth considering, because it's becoming more costly for police forces to have adequate amounts of Narcan, because it's taking multiple administrations or doses to have the desired effect of reversing an overdose. And so that's like, a super downstream solution to the opioid addiction. It's not really a solution, for supposed Band-Aid, but it's life-saving.
Mhm.
And so is that something that is and can be part of this process? And if so, is it more than historically covered in Narcan doses?
We couldn't agree with you more. And while it is not on this particular budget through block grant, it is on our budget for our state opioid response, for example. And we disperse thousands and thousands of Narcan kits across the state. So certainly we can have an offline conversation. If there is a need in a particular area of the state, we are poised to help with Narcan distribution.
In the acknowledged Eastern Connecticut section of the state. So thank you very much.
Statewide.
Yeah, that's where I am. So thank you so much, but I'd love to talk offline.
Sure.
Thank you. I guess the questions, especially from my colleagues, is that is this plan set in stone, or are there any abilities to make any adjustments because of the circumstances of what we are all experiencing out in our communities right now? So I'm just asking Acting Commissioner if you can.
Sure, there are always ways to pivot the resources. We do have plenty of discretionary dollars that we have been awarded from the feds to address the Narcan issue, but we are always poised to pivot depending on what is going on in the communities.
And I just want to let my colleagues also know that the agencies have basically come in at the same amounts pretty much in most of their block grants, even though there is speculation, strong speculation, that there may be more money. And one of the things that I just wanted to let my colleagues know is the fact that if there is money that exceeds the bottom line amounts in each one of the block grants more than 50,000, then we have a way of influencing how those dollars are used through our leadership, both in the House and the Senate, because the President Pro Tem and the Speaker of the House will have to respond to those allocations that are proposed by the agencies in utilizing it. So I would suggest that we all make a point of contacting them now and saying that we hope that the decisions on how any new monies that come in will come back to the three committees who have cognizance over this money to be part of the discussion to make sure that the items that all of our colleagues have identified are addressed in additional dollars, which so I just wanted to throw that in for everybody's information. And I will expect to hear from my speaker that you guys have all said your point. So I thank you for the support and thank you for the continued information. Representative McCarty.
Thank you very much, Madam Chair. And you actually just covered part of my question, that it looks like there might be a significant increase in federal funding up to 105%, I think I read in the literature. So your question was very timely, because I'd like to, we have some new creative programs on the Navigator program to try to implement throughout the state. And I would hope that that plan would be able to go through, but I'm just curious to the commissioner if she has any sense of when we would have an idea about whether the increase in funding. So currently this block grant will stay stable at the same amount of funding from the prior year, but when, and I may not be able to answer that question, but when do we think we might have some notion of when the federal increase might occur?
Next calendar year. So perhaps by the first quarter of the next calendar year.
Okay, and then this is not associated with this block grant, but I do understand that we do have a settlement in place that we may be able to look at some of the funding. I just wouldn't want to see us hold back in any of these new programs that I think need to go forward. So thank you.
Sure, that would be certainly any legislation that was passed that did not come with funding, we would look at first. We would look at those things first.
All right. Thank you very much, Commissioner, and all the best to you.
Thank you.
Thank you. And I also want to say again to my colleagues, please, if you have some things that you think really require our financial backing in other areas in any of these block grants, please contact us and let us know so that we all can sort of sign on to getting that information to the President Pro Tem and the Speaker of the House so that they understand the importance of it. Next, I think, thank you, ma'am. And if you could just sort of stay around, because you have another block grant?
Yes, I do. I can continue with that if you're ready.
Mm-hmm.
Okay. The mental health block grant funds community-based mental health services for both children and adults. We historically share 30% of the mental health block grant with DCF, and we will continue to do that. Again, the funding is based on level funding. We currently get $6.9 million. And again, there is a proposed budget out there at $15.5 million, which would also be a significant increase, just like we saw on the substance use side. We decided to stick with the flat planning just because we don't have those dollars in hand and we don't want to put our system of care at risk. DEMAS has historically utilized block grant funds to supplement state funds allocated to various levels of care, including emergency crisis services, outpatient clinical services, residential services, employment, case management, social rehab, etc. DEMAS continues to align with the SAMHSA's express preference to fund non-reimbursable services with block grant dollars. However, given that attaining and maintaining insurance coverage is a challenge for many of our clients, Demas recognizes that a certain percentage of the population it serves will be uninsured or inconsistently insured. In consequence, Demas continues to utilize a small amount of block grant funds for services for these individuals. And we do not use any of the block grant funds to fund state positions or staff positions. Our block grant allocations are consistent with the prior year's funding this year, in keeping with the emerging national focus on emergency behavioral health services. SAMHSA implemented a mandatory 5% set aside for block grant dollars in crisis. Connecticut historically exceeds this minimum amount, so we are beyond that. We are allocating $2.1 million of the block grant funds for emergency crisis services, which is about 40% of the award. This funding will provide continued support for emergency behavioral health service system, which includes the centralized call center or action line, which operates 24/7. It also provides some funding for our mobile crisis teams, supporting clients in crisis, and our crisis respite beds. State funding for mental health services is not reflected in this plan. The block grant is approximately 1% or less of our total budget. So this is a very small amount, but it nevertheless provides an opportunity to incorporate priorities based on data from local, state, and federal sources, input from our advisory organizations, and our own initiatives. These federal funds supplement the state general fund dollars. So thank you for the opportunity. This concludes my portion of the testimony. I can answer questions or pass the baton to DCF, and we can answer questions following that.
No, what I'm going to do is let Senator Austin, if any other questions, and then I'll ask DCF to testify. Senator Austin.
I'm going to go to the question I asked before and say that there's a decrease in adult mental health services for mental health, different than substance abuse. So I'm just curious, is that just a small portion of the dollars available? Was there an increase in other funding relative to adult mental health services?
There is not any decrease in our contracts or services with our providers. No one will receive a decrease in their contract. So if something shows as a negative, for example, family education and training shows as $13,000 less than the previous year, that is simply a matter of the sequencing of invoices. So there's not an exact match with the state fiscal year and the federal fiscal year, so it could be an invoicing issue.
Thank you. Thank you very much. Thank you, Madam Chair.
Thank you. Thank you, Senator Austin. Representative Dillon.
Thank you, Madam Chair. And thank you, Commissioner. To the issues that were raised earlier by my colleagues on whether or not any additional dollars would be available, I'm not sure those federal dollars are realizable, and I'd like a pony too, but we'll see. Maybe it will happen. I don't really want a pony. But I am very concerned. You know, there's no duty to treat on the part of clinicians in the community, given the source of payment. And we are down. We learn every year, but it's worse, that particularly with psychiatrists, but not only. We are down clinicians seriously in the Department of Mental Health. We're down clinicians in corrections too, if I remember correctly. But I'm worried because I don't know. We can talk about fancy plans, but I'm very concerned going forward as we're looking at different financing models. Who's going to be providing the care and where are they going to be providing it? And it may not be something that you can address today. And I know people have told me nobody works for the state because they pay so badly and nobody trusts them. And I don't know if that's true. It may be retirements. I have no idea what it is. But Demas is down positions, and it's seriously down. In fact, last year, we were paying more for people out of the OE account because they were kind of on contract rather than paying out of the personal services account, if I recall correctly. So I guess I just want to ask, I don't think anybody's approached you because we don't have any money yet, but if there are any excess dollars available for the general fund or for any, whatever pot it would be in, do you see any potential movement on recruiting clinicians for DEMAS?
That is a constant, thank you for the question. It's a constant process. And I do acknowledge that there is a national behavioral health workforce crisis. So it's difficult to recruit across the United States. It's not in particular to Connecticut, it's everywhere. Our private nonprofits are having difficulty recruiting, as are DEMAS and other state agencies because of the workforce issue.
Thank you.
But my question was, I respect that it's a nationwide problem, but it's a Connecticut problem, and I live here, and those folks serve people in our communities. We made a commitment years ago when we closed the hospitals, and then we closed one prison after another because we learned that many of the people in those prisons didn't belong there because they were there on technical charges that were driven by their underlying substance abuse and mental health problems. The fact that they didn't belong in prison didn't mean that they didn't need help. It meant that they didn't need that help. So that I hope that failure to appear outweighed everything, but many of them had been arrested on misdemeanors were related to drug and alcohol and also related to underlying mental health. We have now let people out of the prisons. We've closed two mental health hospitals. I hope that there's a plan for having a more robust clinical presence in the Department of Mental Health, or all of the communities that have people who were in institutional settings. They need care, and we need to have people to provide it. Thank you, Madam Chair.
Thank you. Thank you. Thank you, Representative Dillon. I don't see any other hands raised for now, so I will move on to Department of Children and Families. And Deputy Commissioner Williams, I believe it's your lead this time, sir.
Sure, and good afternoon, Representative Walker and Senator Austin chairs, and to the distinguished members of the legislature from the Appropriations, Public Health and Human Services Committee. I am Michael Williams. I'm the Deputy Commissioner of Operations for the Department of Children and Families. And this afternoon, I'm joined by Joshonda Courier, who's the Administrator for Clinical and Community Services, and by Tim Marshall, who's our Director of Community Mental Health. And thank you, as always, for the opportunity to present how the department is proposing to spend the federal fiscal year 2022 allocations for the children's portion of the Community Mental Health Services Block Grant. The department, we're proposing to use the funds from this block grant to further our vision for a comprehensive community-based mental health service system for children and their families. These federal dollars they play a critical role in meeting the department's mental health mandate and for strengthening the mental health system in Connecticut, resulting in positive outcomes and allowing children to realize their fullest potential. The services and supports provided with block grant funding are important components of the foundational elements that we at DCF have embraced through the system of care model, which aims to maintain children with mental health issues or challenges in their homes and communities through both the efforts of local consortiums and the Connecticut Behavioral Health Partnership. In collaboration with community providers, state agencies, and families, the department is working to ensure that children and their families receive the care and services that they need. Similar to the years past, The Community Mental Health Services Block Grant continues to provide supports and resources that are not funded by Medicaid or other sources, including access to local community-based family supports and resources to enhance the quality of existing community-based services. In this way, block grant dollars are blended with other state and federal resources to increase their impact and improve outcomes for children and families. We propose to dedicate roughly $2.8 million from the federal fiscal year 2022 block grant, supplemented by prior year carryover funds to support the following multi-year initiatives at the same levels as we did in last year's allocation plan. And as you can see listed, we're continuing to invest in respite care for families, which families continue to say is among the priority needs, as well as FAVOR, which provides advocacy and direct kind of hand-holding for families and parents, children who have mental health needs to help navigate through the system. We continue to invest in youth suicide prevention, as we know continues to be an escalating situation here in Connecticut and across the country as we continue to be in the midst of this pandemic. Our Kid Care program, we're making a targeted investment on workforce development so that we can have training and build our workforce in a culturally competent way and be able to provide more culturally competent care. We are refining our model around extended day treatment. We are making a sizable investment once again in the early serious mental health and mental illness and first episode psychosis to really be more preventative in nature, that on first episodes we are able to intervene and prevent further involvement in the system for young folks. We are improving our outpatient care by making an investment in system and treatment improvements. We're promoting best practices by making investments among some of the evidence-based programs that are out there to assure that they are at scale throughout the state. Workforce development, again, working with higher education to do the in-home work, because a lot of the effective programs calls for in-home intensive kind of treatment models, and continuing to develop a workforce that can do that is key for us. We're investing in outcomes through our Performance Improvement Center by investing more in data development and having data dashboards accessible to all of our providers. And again, there's other Kid Care investments, and then a final investment in our emergency services, which across the state, needing to be sure that we have mobile access and mobile responses 24/7. So in closing, congruent with the federal mandate to transform the state's mental health system and create a comprehensive system of care, we're using these funds and are incorporating them into the department's overarching strategy and vision for a broad array of quality, accountable, family-centered, racially just and culturally competent and trauma-informed services for children with complex behavioral health and specifically mental health needs. Services and activities funded through the Community Mental Health Services Block Grant are integral to our ongoing effort to reduce the reliance on congregate care and to enhance the continuum of services in the service array available to children and their families. So we'd like to thank you all for this vision for behavioral health care in Connecticut, that you have inspired us and charged us with being the responsible state agency, and its continued support to us for implementing this mental health mandate. Thank you.
Thank you. Thank you, Deputy Commissioner. Senator Austin.
Thank you very much, Madam Chair. And my question goes directly to the balance forward from the prior year. This may be for both of you. I noticed that the block grant essentially stays the same, and the balance forward from the previous year is down $1.2 million, almost $1.3 million. Is that because you expended more in the of the carry forward dollars earlier, or what is that? What would that be reflective of?
I'll have Tim Marshall give you the exact answer, but you're right in the ballpark in regards to continued investments and assuring that as needs escalate, we are able to meet those needs with the federal resources that we have. So Tim, for a more specific answer.
Sure. So one of the challenges is the way in which the timing of the federal dollars become available. So by the time contracts are executed and then reporting out for the next, we often only have 6 or 9 months of expenditures that have occurred. So we're constantly, we're frequently building the possibility of carry forward. So we are try to keep that to a minimum. And then when we carry over, that gets too big, we'll try to allocate more dollars on one-time kind of needs and then try to get that back down. But essentially it's the carryover that really builds from what was originally an annualized amount.
So that is a carry forward from the block grant from the year before based on how you received the invoices. So essentially you're not spending less dollars. Would that be true, Tim?
Yes.
Thank you very much. Thank you, Madam Chair.
Thank you. Representative McCarty.
Thank you very much, Madam Chair. My question would go to, I believe, the Deputy Commissioner, just about, if I may, in general, look at the federal allotment process. And they ask you to meet certain needs, for example, the population at risk index and the various indexes. I'm just curious to the Commissioner, do those federal requirements, do you feel constrained at all, or is there enough flexibility for the state to meet those all of the continuum of care that they need for the mental health needs? I'm just curious as to whether you can work well within those guidelines. Mm-hmm. Thank you.
Yeah, thank you. That's an interesting question. The direction that the federal government has taken as it relates to children's mental health is fully informed by leaders in the mental health community across the country as what's best for children. And so we have had the fortune of these block grants being allocated to states with criteria that meets the needs of children that won't allow us to use these in a way that children needs are not met. And so we're somewhat fortunate for that. And then there are some criteria or some guidelines as well that are absolutes that you have to make an investment with the dollars in that are priorities to set forth. I'll let Tim talk a bit about what those are. But for us, yes, the answer is yes. The criteria is there that keeps us within parameters. But the good news is the right criteria, because it guarantees that the investments are made appropriately in the mental health needs and meeting the mental health needs of children. Tim, why don't you share the exact areas that we have to make a certain percentage of our allocation and investment in?
Sure, thank you. Yes, so there are 2 required set-asides. I believe the Commissioner from Demas also alluded to them. There's a 10% required set-aside for first episode psychosis, and there is a 5% required set-aside for crisis services. Both of those on the DCF side, and as Demas reported on there, we exceed that amount. So both of those are special populations, and they come in the 20-year period. This is like the fourth or fifth required set-asides when they'll actually name special populations of need that we need to address. But I would add to Deputy Commissioner Williams' comments. The federal requirement is to meet the federal definition of serious emotional disturbance, which is not a very family-friendly or child-friendly term, but it is the federal term. And it is a very, very flexible term, and we can purchase a very broad array of services. So it is a very adequate measure of being able to meet children's needs. The only thing, there's a very few exclusionary. You can't spend it 100% on a particular special population that might have other funding sources. So substance use, child welfare, juvenile justice, they could have co-occurring issues, but they can't be exclusive. That's the only, some of the only areas of restriction.
Thank you very much for that extra explanation. Much appreciated.
All set, Representative?
Yes, I am. Thank you.
Thank you. Up next is Representative Dillon on the block grant.
Thank you very much, Commissioner, Madam Chair. And thank you very much for your testimony. I'd like to ask about the first episode program in terms of how you do outreach. Do you work with the churches at all? I ask specifically because my experience sometimes has been certain kinds of behavior. Maybe the family would have a difference about whether or not the behavior exhibited was the result of the not attending church enough versus a mental health issue. And I wonder if you have a formal relationship with the churches.
I'll answer it in a couple of ways, and then because mine would be a lot more general than the specific program itself that Tim is responsible for implementing. And that is, as a department, we do have a faith-based initiative where we work in faith communities on a range of children's issues, from child welfare to juvenile justice, and with mental health and prevention and foster care. So we have that relationship, and we have an ongoing dialogue with faith leaders. As it relates to first episodes, which is a very specific intervention for when a child has their first psychotic episode, usually our interventions and working relationship starts with the hospital or with the family. The organization Favor is one that is nested pretty closely within a lot of communities around the state, with that patterns our system of care collaborators around the state, and those family members who are somewhat like mentors and handholders of parents who have children who have their first episodes have been very effective in keeping us connected. Tim, why don't you share a little bit more detail about how that operates?
Sure. So there's a few different ways in which we address this issue across the state. Primarily, we have, as additionally to the kind of the Favor being fully aware of the different programs and then being aligned with families so strongly. And I would again reiterate the faith-based community. We also have care coordination and peer support staff who also reach out directly to families of youngsters and or emerging adults whom have experienced a first episode psychosis. Part of that is not only outreaching to those who have just recently experienced a psychotic issue of one kind or another, but it is also to continually educate and outreach to anybody in Connecticut so that they're aware that this program exists. One of the reasons for the required set aside is it's a very small percentage of your population, but it is it's a huge issue in terms of competencies, in terms of who can respond and what. If you respond quickly and efficiently with good evidence base, it's one of the strongest ways to avoid long-term impairment. So you can get folks back to school and back to work if you get into the treatment episode as quickly as possible. So it is a high value in both quality of life and reducing costs, because if without treatment, people go on and develop full-blown psychotic mental health issues for a lifetime, it then takes away from the workforce in other ways. So it is, yes. So to answer your question, there are numerous ways in which we can work with the community, including the faith-based community.
Thank you. And a follow-up, and you could provide this later to the committee. Keenly interested in the overlap between the population involved in first episode and the criminal justice system. Because depending on the thought disorder, you could very well, and I can think of a case in my own district where a young person
was hospitalized and threw the computers on the floor that were in the office. Didn't want to be there, was convinced everyone was out to get him, and ended up in lockup, and then pretty much spent a fair amount of his time in the criminal justice system. Do you have a formal relationship concerning the age target population, the age with the juvenile justice system or the police to make sure that folks get care and maybe keep them out of the juvenile justice system if possible?
That's a great question, because we have just resurrected our protocol with CSSD related to children who enter into detention or in lockup due to whatever the episode may be, to where we are immediately notified, and we have a response to that child to determine whether or not detention stay or further incarceration can be diverted by referring the child to the mental health services that child needs. So our protocol requires us to respond with a clinical assessment of the child that has been brought into detention or has been arrested. And we have the mechanisms in place to assure a proper disposition is made for that child. It was a great protocol we had several years ago after a consent decree entitled Emily J. That because it was very successful, it stopped, but now we realize the need to restart it. So CSSD and DCF are doing that once again.
Thank you. And Madam Chair, thank you very much for your indulgence. I'd appreciate more information about that first episode program, because you're quite right. If you can present a lifetime of stability, it could be an extraordinary thing, but we have to do it appropriately. And so any other information, if you could provide it to the committee, I'd appreciate having a follow-up conversation. That's it. Thank you very much, Madam Chair.
Thank you very much. Thank you, Deputy Commissioner. I see no other hands. We're moving right on to the DSS team. Deputy Commissioner Brennan, are you ready?
I am ready, Senator Austin.
Alrighty, let's go.
Madam Chair, may I ask you to allow Cassandra Norfleet Johnson to post a PowerPoint we can go through to help guide the conversation?
Go ahead. Kathy should be all set. There she is.
Oh, thank you so much. Okay, so good afternoon, Senators Austin, Moore, Berthel, Lessel, Minor, Representatives Walker, Garibay, France, Case, Dathan, and Nolan, and distinguished members of the Appropriations and Human Services Committee. I'm Kathy Brennan, Deputy Commissioner of the Department of Social Services. I am here with the DSS team, including Peter Hadler, Carlene Taylor.
Excuse me a minute, Deputy Commissioner, we've lost the, there it goes.
There it is.
Right. And if we could just go through the slides quickly. How many slides do you have?
I think there's 2 block grants here, so there's about 20, but we'll be quick.
Oh, okay, we got to move pretty fast through the slides. Nobody else has slides, so let's go.
They just help guide it. Okay, go ahead, Cass, forward.
Next.
Go ahead, hon. Okay, we're going to start with the SSBG block grant. Okay, that's the first one. It's administered by HHS. It provides a flexible funding source that allows states and territories to tailor social service program to their population needs. We fund programs that are administered not only through DSS, but also programs that are administered through DEMIS, housing, labor, aging and disability services, and through direct contracts to private nonprofit organizations. SSBG programs provide essential social services that help to reduce dependency and promote self-sufficiency, to protect children and adults from neglect, abuse, and exploitation, and to help individuals who are unable to take care of themselves to stay in their home or to find the best alternative living arrangements. Next slide, please. Our target population are vulnerable persons or families with special emphasis on those groups which are less able to care for themselves. Income eligibility are households at or below 150% of the federal poverty level, which for a household of 4 would be about $39,750. There are 2 exempt categories that I'll talk about in a minute to the income requirements. Next slide, please. Where do our SSBG funds go? I just mentioned they are used by DSS in our Office of Community Services, Social Work Services, Child Support. We also share with our sister state agency and to private nonprofits. The SSBG service categories are on the right-hand side of the slide. The 2 that are asterisks in red, employment services, as well as home-delivered meals. We do not, income eligibility is not required for those services. Next slide, please. So we estimate the 22 allocation level to be about 17.4 million. That's the block grant, which is level funded from federal fiscal year 21, plus $6.2 million in carry forward. So we have a total of about 23.6 million in SSBG funding. We expect to expend 18.4 million and carry forward the balance of the 5.2 to mitigate any future reductions and to ensure program continuity. As I mentioned, this plan allocates funding to 12 different service categories. This slide before you is also table A in the plan. You should also have, we had provided in advance descriptions of our different service categories. Next slide, please. This is just a different version of the plan of the allocation shown in a pie chart. Next slide. And actually, you can go to the next slide, Cassie. This is just going to talk about the changes in our proposed federal fiscal year 22 plan from 21. Actually, these are case management services. There's a proposed decrease. Obviously, it shows the reduction in funding that was increased in 21 for one-time expenses related to the pandemic. This new funding for 22 aligns with our proposed needs. Family planning services, again, it appears to be a decrease. That's because there was one-time increase in 21 for anticipated needs during the pandemic. Next slide. Home-based services. The funding of $2 million is proposed to support the current program activity, which is a reduction of about $800,000. This plan proposes to reallocate the 800 plus some unspent carry forward in this particular category item to support increases in several different areas. Right there, protective services for adults, case management, family planning, and home delivered meals, as well as other services. In home delivered meals, there's been a reallocation of funding after a discussion with Aging and Disability Services and a one-time transfer of that amount into our home-based, from our home-based services. Protective services for the adult, we increased the service categories with also funds that were transferred from the home-based services to cover projected expenditures in that area. Finally, social services for persons with developmental or physical disabilities. At the request of Aging and Disability Services, we decreased that funding and reallocated 55,000 of it to home delivered meals. The increase in other services that came from the home-based services is going to help support us, the department, in obtaining 2 social services program assistant technicians. That will help us be able to process applications and reimbursements for home-based services and protective services for adults, and hopefully will address the carry forward that we continue to have in those areas. That concludes the SSBG allocation plan. I don't know if you have any questions on that or if you want to go right into CSBG.
Does anybody have any questions? You're going to have to, I don't see any questions. Nope, go right into the CSBG, please.
Okay. All right, so our CSBG allocation plan, in advance, you should have received our written testimony as well as the CSBG fact sheet that can provide some additional guidance. Again, CSBG is administered by HHS through its administrative agency, ACF, and the Office of Community Services, DSS, is designated as the principal state agency. Through CSBG, funding is provided to states. We work through a network of community action agencies in Connecticut, of which there are 9. They work to reduce poverty, revitalize low-income communities, and empower low-income families and individuals to become fully self-sufficient. We're proud of the work of our CAAs, and we rely on them to help our people in need. Next slide, please. Our CSBG allocation plan is $8.84 million from the block grant itself. That is proposed level funding from federal fiscal year 21. We have about $4 million of carry forward from the previous year for total funds available, about $12.8 million. Of this, of the total amount, we allocate 90% of the block grant dollars, or 7.9 of the 8.4 to our eligible entities, which are our 9 community action agencies and 1 limited purpose agency, which is CAFCA. The remaining 10% is split evenly between 2 areas, discretionary programs and administration. Next slide, please. This is just a pie chart of the, again, the allocation of the block grant shown between the CAAs, discretionary and administrative. Next slide. This is a breakdown of the funding that goes to each of the community action agencies. And again, that is in the plan on page 14. Next slide, please. So the CAAs use this funding to plan, organize, and coordinate the delivery of services within their community. They also use the CSBG funds to support their core administrative services. As I mentioned, the remaining 10% is between discretionary programs. That is being used by the department to support training, to provide technical assistance, compliance initiatives, and other programs to help strengthen the CAA network. And the remaining balance of the $442,000 is to support DSS admin in order for us to have the appropriate quality assurance and programmatic staff to provide fiscal and oversight of this program. Again, this slide just shows the services that are provided, the eligibility requirements for CSBG, and our reliance on our community action agencies for the services that they provide. Next slide, please. Finally, I'd mentioned quickly that part of our requirement as the administrators of this particular grant, that we have a lot of federal requirements. One thing that we instituted back in 2020 were to provide performance incentives for our community action agencies. We use the discretionary dollars, so none of the direct program dollars that go to the CAAs are impacted by us putting together this performance incentive. But as you can see from here, we have seen an increase and an improvement in the performance of our community action agencies in accordance with the Centers of Excellence. And as a result, they have received some additional funding to help support the agency. That concludes the CSBG block grant allocation.
Okay, if you could take down thank you. Are there any questions? Representative Case.
Thank you, Madam Chair. Happy birthday. So just a quick question. With the CAAs and the block grants, I believe we had a meeting a week or 2 ago, and is some of this 12 million, is that for energy assistance?
No, it's not, Representative. Thank you for the question. Energy assistance, that's completely funded through the LIHEAP program. And you're right, that was the block grant that we did a couple of weeks ago.
I thought so. I just saw energy assistance, and that was just explaining what the CAAs did, correct?
That's correct. Thank you.
I just saw that in there. I wanted to see if there was allocations there. Thank you. That's it, girl.
Thank you. Are there any other questions? Seeing none. Thank you very much, Deputy Commissioner.
Thank you.
Rosario has his hand up.
Oh.
Who does?
Rep. Rosario did.
I don't see his hand up at all. Representative Rosario, do you have your hand up?
No, I do not.
Yeah, there's no hands up, Representative. Thank you. Thank you. Thank you, Deputy Commissioner. Up next is Deb Poulin for the CAAs.
Thank you. Good afternoon, everyone. For the record, my name is Deb Poulin, and I'm the Executive Director of the Connecticut Association for Community Action, or CAFCA. We are the state association that works with Connecticut's 9 community action agencies, which are our anti-poverty agencies. And as you've heard, they provide a variety of services to low-income people across the state, including energy assistance, SNAP outreach, Head Start, Meals on Wheels, case management, and a variety of other services. You have my written testimony, so I just wanted to take this opportunity to thank both our partners at DSS and at the legislature, particularly the members of the Appropriations and Human Services Committees, for your support of community action agencies and the services and programs that we provide to about 200,000 low-income people across the state, including in all of your districts. It is our honor as CAFCA and the community action agencies to receive these funds from both Community Services Block Grant and from the Social Services Block Grant to serve low-income people. These federal funds benefit over 200,000 people in Connecticut every year. And I'm happy to answer any questions about those programs today, or if you want to get in touch with me in the future and ask questions, that's also fine. Thank you so much.
Thank you very much, Deb. Appreciate all the work you guys do. Are there any questions? Seeing none, thank you very much. We're going to close the public hearing right now, and all of you who are speakers from the different agencies and the public, if you could sort of go away so that we can figure out who is actually a senator or a representative on here, that would be very good. So I'm going to ask all of my colleagues to make sure that they contact the people that are on their respective committees and tell them we're getting ready for a vote. All people who are on any of the committees, we're now going to get ready for a vote. So if you could start contacting people and ask them to come on, that would be great. Madam Administrator, my understanding is that this will be one vote for all 6 block grants together. Is that true?
That will be true for the Appropriations Committee, and for the Public Health Committee, it will be the block grants under their jurisdiction, and for the Human Services likewise. And we'll start with the Public Health Committee.
All righty then. So the Public Health Committee will be the first one. And please remember, the reason why you need to get in touch with everybody is the votes will not be held open. The votes will not be held open. Once the tally is read, once we go to the next committee, that committee it cannot change the vote. So keep that in mind. We want to get people in and ready to vote. So the Public Health Committee is up first. Is a Public Health Committee Chairwoman, Senator Abrams, are you on?
Senator Austin, I believe that Representative Senator Abrams may be on another call simultaneously, so I'll take the lead on this, if that's all right with you.
It's fine with me, sir.
Thank you then. Do I have a motion with regard to the collective block grants?
So moved. Second.
Moved and seconded. Do you have those?
I did not get the motion. Was that Representative Terziak?
Terziak, yes, I believe, has a second.
Whatever.
Okay.
I'll second it.
And it may have been Senator Kushner who had the first, but I'm not exactly sure.
Yeah, but that's okay. Either way.
In any case, are there any comments or questions before we have the vote? Seeing none, Madam Administrator, I believe we are ready for the vote.
Senator Abrams.
Senator Mary Dart. Oh, it's okay, Beth?
Go ahead, please.
Okay. Senator Mary Darty Abrams votes yes.
Thank you. Representative Steinberg.
Representative Steinberg votes yes.
Senator Anwar. Senator Kushner.
Senator Kushner votes yes.
Representative Gilchrist, Senator Wong,
Senator Tony Huang votes yes.
Senator Summers,
Senator Summers votes yes.
Representative Pettit,
Representative Pettit votes yes.
Representative Arnone, Representative Berger-Givallo, Representative Betts, Representative Carpino, Representative Cook,
Representative Cook votes yes.
Representative Dauphiné, Representative D'Amico,
Representative D'Amico votes yes.
Representative Elliott, Representative Foster, Representative Django, Representative Green, Senator Haskell,
Senator Haskell votes yes.
Representative Kennedy,
Kennedy votes yes.
Representative Pepperidge DeGraw,
Pepperidge DeGraw votes yes.
Representative Clarice Detrier,
Representative Clarice Detrier votes yes.
Representative Lenahan, Representative McCarthy,
Representative McCarty votes yes.
Senator Moore, Senator Moore votes yes. Representative Parker,
Representative Parker votes yes.
Representative Ryan,
Representative Ryan votes yes.
Representative Scanlon, Representative Terziak,
Representative Terziak votes yes. Thank you.
Representative Young,
Representative Young votes yes.
Representative Zupkis,
Representative Zupkis votes yes.
Seeing that we're not holding the votes open, Madam Administrator, do you have a tally?
total voting 19, those voting yea 19, absent and not voting 13.
Motion to approve passes. Is it appropriate for the committee to adjourn, or we want to wait till the other committee?
You have to recess.
You have to recess.
Okay, so the Public Health Committee will recess until further advisement. Back to you, Senator Austin.
Madam, just so you know, Representative Steinberg, it won't be long that you'll be coming back in to adjourn. Madam Administrator, who would you like next?
The Human Services Committee, please.
Human Services, would somebody like to take that on? Senator Moore?
Yes, I can do that. Thank you. Good afternoon. I'd like to make a motion for the collective block grants. Is there a motion?
So moved. Nathan?
Second.
Second.
Been moved and second. Are there any questions or comments? Seeing none, I would ask the clerk to take a roll
There is a
call.
comment. There's a hand up.
Representative Belinsky?
I'm sorry, I had a question for Madam Administrator of the Appropriations Committee. My apologies to you, Madam Chair.
Not a problem. I didn't think you were on Human Services, but you know.
Oh, thank you.
Can never guess. All right, what's happened? All right, so then we'll do the roll call vote.
Thank you, Madam Chair. This is to approve the block
grant allocation plans, FFY 22 Community Mental Health Services in concurrence with the Public Health Committee, FFY 22 Social Services Block Grant, and FFY 22 Community Services Block Grant. Representative Abercrombie. Senator Moore.
Senator Moore votes yes.
Senator Berthel.
Good afternoon. Senator Berthel votes yes.
Representative Case.
Representative Case votes yes.
Could you please repeat that, Representative?
Representative Case votes yes.
Thank you. Senator Lesser.
Senator Lesser, yes.
Representative Garibay.
Garibay votes yes.
Senator Cabrera. Representative Butler. Representative Cook.
Representative Cook votes yes.
Representative Dathan.
Representative Dathan votes yes.
Representative Goupil.
Representative Goupil votes yes.
Representative Hughes.
Representative Hughes votes yes.
Representative Santiago.
Santiago votes yes.
Representative Simmons. Representative Stallworth.
Representative Stallworth votes yes.
Representative Aurora.
Representative Aurora votes yes.
Representative Buckby.
Representative Buckby votes yes.
Representative Master Francesco. Representative Scott.
Representative Scott votes yes.
Representative Wood.
Representative Wood votes yes.
Thank you. Are there any members of the Human Services Committee who have not yet voted who would like to vote now? Madam Chair, I'm ready with the tally.
Thank you. Would you read the tally, please?
Thank you, Madam Chair. Total number voting, 15. Those voting yay, 15. Those voting nay, 0. Those abstaining, 0. Those absent not voting, 5.
Thank you. I'm going to recess this portion for the Human Service Committee.
Thank you very much. Madam Administrator, are you ready?
I am ready.
Alrighty, this will be a motion to approve all 6 block grants. I'll entertain a motion to approve all 6 block grants.
Motion,
Porter.
Second, Valinsky.
Moved by Representative Porter, seconded by Representative Valinsky. Are there any comments or questions? Representative Valinsky.
No, ma'am, I was not certain that the Appropriations Committee had voted. I had to step away for a constituent call, but I will get back in line and wait my turn. Thank you.
All right, thank you very much. It's been moved and seconded to approve all 6 block grants. Madam Administrator, would you call the roll, please?
Yes, Madam Chair, and just to be clear, the FFY 22
It's just someone was not muted. That's all.
the maternal and child health services and preventative health and health services block grants the vote will be in concurrence with the Public Health Committee, in addition to the Substance Abuse Prevention and Treatment block grant. Those 3 will be in concurrence with the Public Health Committee. The Community Mental Health Services block grant will be in concurrence with the Public Health and Human Services Committees. And the Social Services and Community Services block grant allocation plans will be in concurrence with the Human Services Committee. Senator Austin.
Senator Austin votes in the affirmative.
Representative Walker.
Thank you, Madam Minister. Representative Walker votes in the affirmative.
Senator Hartley,
Senator Hartley in the affirmative.
Representative Dathan,
Representative Dathan votes yes.
Representative Nolan,
Good afternoon. Representative Nolan in the affirmative.
Senator Minor. I know Senator Minor has been having technical difficulties today. Representative France,
Representative France votes yes.
Representative Abercrombie, Senator Doherty Abrams,
Senator Doherty Abrams votes yes.
Senator Anwar, Representative Baker, Representative Baker, Representative Betts, Representative Belinsky,
Representative Belinsky votes in the affirmative.
Representative Candelaria, Senator Ciccarella, Representative Curry,
Representative Curry votes yes.
Representative Dillon,
Representative Dillon votes yes.
Representative DeMassa,
Representative DeMassa votes yes.
Representative Felipe,
Representative Felipe votes yes.
Representative Ferraro,
Representative Ferraro votes yes.
Senator Flexer,
Senator Flexer is in a parked vehicle and votes yes.
Thank you, ma'am. Representative Gibson, Representative Gilchrist, Representative Gonzalez. Representative Gonzalez is also having technical issues today. Representative Haddad,
Representative Haddad in the affirmative.
Representative Carol Hall, Representative Joshua Hall, Representative Harrison,
Representative Harrison votes yes.
Representative Hayes, Representative Howard,
Can you hear me?
not yet, Representative Baker. I'll swing back to you.
Representative Baker votes yes.
Thank you.
Thank you.
Representative Howard, Representative Johnson, Representative Kennedy.
My daughter had a.
Excuse me? Representative Kennedy.
Kennedy votes yes.
Thank you, ma'am.
Thank you.
Senator Kushner,
Senator Kushner votes yes.
Senator Lesser.
Senator Lesser votes in the affirmative.
One more time for me, please.
Senator Lesser votes in the affirmative.
Thank you. Senator Lopes,
Senator Lopes votes yes.
Representative McCarty,
Representative McCarty votes yes.
Senator McCrory, Representative McGee, Representative McGee, Representative Pavelak-D'Amato, Representative Porter,
Representative Porter votes in the affirmative.
Representative Reyes, Representative Rosario,
Representative Rosario votes in the affirmative.
Representative Ryan,
Representative Ryan votes yes.
Representative Sanchez,
Sanchez votes yes.
Representative Sims,
Representative Sims votes in the affirmative.
Senator Summers,
Senator Summers votes yes.
Representative Terciak,
Representative Terciak votes yes.
Representative Turco,
Representative Turco votes yes.
Representative Wilson, Senator Winfield,
Senator Winfield in the affirmative.
Representative Zawistowski.
Representative Zawistowski votes yes.
Okay, and so as Senator Minor joined us, Senator Anwar, Representative Betts, Representative Candelaria, Senator Ciccarella,
Senator Ciccarella votes yes.
thank you, sir. Representative Gibson, Representative Gilchrist, Representative Gonzalez,
Hold on a second.
Representative Carol Hall, Representative Joshua Hall, Representative Hayes, Representative Howard, Representative Johnson.
Here.
Can you hear me? Thank
Hi.
you. Hi.
Thank you so much. I vote yes.
Thank you, ma'am.
Thank you.
Senator McCrory, Representative McGee,
From the McGee's daycare, Representative McGee votes yes.
thank you, sir. Representative Pavelak D'Amato, Representative Reyes,
Representative Reyes votes in the affirmative, ma'am.
thank you, sir, and
Thank you.
Representative Wilson. Are there any other members of the Appropriations Committee who need to cast a vote who haven't previously done so?
Madam Administrator, give us the tally when you're ready.
Total number voting 36, those voting yea 36, those voting nay 0, those abstaining 0, those absent not voting 25.
Thank you very much, Madam Administrator. The block grants are approved. I'll entertain a motion to adjourn the Appropriations Committee meeting.
So moved.
Moved by Representative Dillon, seconded by Senator Kushner, I believe. The meeting, all those in favor indicate by saying aye.
Aye.
Thank you very much. The meeting is adjourned. Up next, I think, will be Human Services.
Thank you. I'd like to get a motion to adjourn the meeting.
Motion to Santiago adjourn. Move.
Moved and
Second.
seconded.
Second by Santiago.
Thank you.
It's done. Start coughing.
Oh, I'm sorry, meeting's adjourned.
Yep, thank you all.
Thank you.
I think we're ready for public health, Senator Austin.
You're muted, Senator Austin.
Muted, ma'am.
I'm sorry. Representative Steinberg, are you ready to adjourn your meeting?
More than ready, Senator Austin. Do I have a motion to adjourn?
So moved, Mr. Chairman Kennedy.
The second?
I'll second it.
All right, we got a second. Any objections? If not, the Public Health Committee is adjourned.
All right, so all committees have adjourned and this meeting is now adjourned. Madam Administrator, do we have any business coming up in the next week or so? So you guys should all enjoy yourself over the next couple of days. Look forward to seeing you all in person soon. Have a nice day.
Thank you.
You too. Enjoy your birthday.
Happy birthday.
Bye.